Hi pals, it's me Artie, then in pronouns only, and my video this week is talking about how I am tapering off steroids again. Help. So like roughly since the middle of this year, I have been slowly tapering down on my steroid dose again. I've been at about 5 milligrams of prednisone specifically. Most people talk about prednisone. I don't even know if there's actually a difference, but like I've always been on prednisone, so whatever. So yeah, I've been on the 5 milligrams for a while because the last time I came off of my steroids, I ended up in a huge flare that sent me to hospital, and I had to go back up on like a reasonably high dose of steroids. You can go and see the videos through that process from like I think 2022, because yeah, that was fun. Not. And yeah, and also just generally, as you know, I've been trying to find the right dose of my chemo drug for a while now. Then it was changing the type of chemo drug I was on to find one that actually works and doesn't make me sicker, and just trying to find one that will work to help manage my takayasus without needing to be on steroids. Also, definitely have done like numerous videos on that process too, because it was a mess. It's been a fucking mess. It was bad. Earlier this year, as like a quick brief recap, I think it was in January, late January, early February, I actually switched from being on mercaptopurine as my liver was not having a good time with mercaptopurine anything above a 25 milligram dose, which is very small. So I changed from that to azathioprine. They're very like similar drugs. They're like basically known as sister drugs, and so far it has been doing quite well for me. It's been okay. My liver has not been angry. I'm now on 50 milligrams again, which is still like a small dose, but if I don't need a bigger dose, then I don't need a bigger dose. Like there's no point in me being on a higher dose unless I need to be on one. So for now, I have been on the 50 milligram dose for like a while. I think we started at 25 and then went up to 50. So I don't quite know when it was I went up to 50, but it's been a while, like maybe 6 months, maybe more or less, like something like that. And yeah, once I felt comfortable that things were looking okay with the azathioprine, that my body was reacting well and other signs were good, we decided to start slowly tapering further down on my steroids again. Tapering below 5 milligrams when you've been on steroids for like a long period of time is hard, basically. It gets harder the lower you go, in my personal experience, and it also gets harder the longer you've been on them. I always end up getting rebound pain every time I start tapering down doses of steroids, because steroids are an anti-inflammatory. They're used for pain. They're used to like as a first line of treatment and defense for a lot of autoimmune conditions, because they're fast acting. That's basically the gist. So like, because you know my body has gotten used to being on this medication for God, now it's close to like maybe 4.5 years. It was covering a lot of pain that is not being treated in other ways, whilst also causing all my other meds to not work anymore. Any kind of tapering off or tapering down doses with steroids, I tend to get a rebound of pain that was being masked that I had before steroids. And also because steroids are a hormone, they're basically cortisol. You need to taper really slowly anyway to avoid having an adrenal crisis, because you can die from an adrenal crisis. You have to basically wait for your body to adjust to small lowering of levels and you weaning off of this medication slowly, in hopes that, I don't quite know the right anatomy for it all, but like basically you're just hoping for your body to take the hint that as you are slowly taking away this hormone, you've been giving it artificially for years. You just hope that the body starts taking the hint to start producing its own again naturally. For some people that doesn't happen, but like that's why you have to do it slowly, because if you go into an adrenal crisis, like I said, it's very dangerous, but you may have developed Addison's disease, which basically means you can't produce enough cortisol and will need to be on some kind of steroid for the rest of your life. A quick quote from one of my Mayo Clinic articles I was reading: prednisone is like cortisol, a hormone naturally made by your adrenal glands. If you take prednisone for more than a few weeks, your adrenal glands decrease cortisol production. A gradual reduction in prednisone dosage gives your adrenal glands time to resume their usual function. That's the more coherent way of saying that, I guess. And yeah, like I said, people can often get like a secondary adrenal insufficiency, basically Addison's, but also there's a possibility of developing a like secondary Cushing's syndrome caused by being on steroids long term. They're kind of basically the opposites of the same coin. Adrenal insufficiency, Addison's versus Cushing are kind of like two sides of the same coin. Another quote from the Mayo Clinic: secondary adrenal insufficiency starts when the pituitary gland doesn't make enough of the hormone ACTH, adrenocorticotropin, nailed it, as a result of the adrenal glands. Same? No, it's not what that sentence says. As a result, the adrenal glands don't make enough cortisol. A lack of the hormone ACTH leads to secondary adrenal insufficiency. That can happen if you must take certain steroids for a long time due to a health problem. Oh, that's John Hopkins, sorry. The next bit is from the Mayo Clinic. Cushing syndrome happens when the body has too much of the hormone cortisol for a long time. This can result from the body making too much cortisol itself, or from taking medicines called glucocorticoids. I don't know. Which affect the body the same way as cortisol. And that's from the Mayo Clinic. So, two sides of the same coin. Taking too many steroids for too long, Cushing's. Taking too many steroids for too long, Addison's. So trying to see if your body can start making the right amount of cortisol again can basically just be a very hard and long process. Some people can't come off steroids, or may have to change to a different type called hydrocortisone. From my understanding, it has less side effects, ? To be on that type of steroids like for the rest of your life versus things like prednisone or prednisolone. My own personal experience is I'm gonna say it's kind of like going through a withdrawal, but it also like literally is going through withdrawal at times. Like your body can kind of freak out for one reason or another. I think this is a Mayo quote, I don't know. If you abruptly stop taking prednisone or taper off too quickly, you may experience withdrawal symptoms including severe fatigue, weakness, body aches, joint pain, nausea, loss of appetite, lightheadedness, irritability, or mood swings. And ironically, I experience all of these symptoms in varying amounts day to day when I'm tapering off of low dose steroids. So sounds like I'm going through withdrawal every time I try to taper down. I believe I'm currently going through some withdrawal right now. I recently started dipping under 4 milligrams, and I just am constantly either on edge of a headache or a migraine, or in the middle of one, which is making everything very difficult, because when I have my migraine episodes, like, you just can't do anything. There are so many things you can't do, because I'm then sensitive to light and sound, smell, have to lay down, have to be in the dark. And if I can kind of fight it off, then it's like I can kind of do some things. But this week I've had numerous days, hours, afternoons where I just can't do anything because of a migraine or trying to fight migraines off. So this video ending up being posted this week is actually quite well timed because I am suffering. Oh my god, Jesus Christ. So, yeah, I think I have to taper even slower. So I'm going to add a couple more 4 milligram days in again. And maybe just stick to that for a while until I start feeling better. But we'll see. But I'm at least not experiencing the, like, really extreme symptoms I was having the last time I did this. And definitely did it too quickly. And like, I think as well, people aren't really used to the fact that people with autoimmune conditions can have other conditions as well. So it's not really ever necessarily taken into consideration a lot of the time that like I had pain before starting these meds from conditions that aren't autoimmune disorders, as far as I know anyway. And just every time I taper down, I often just find that I'm just straight up not used to being in as much pain. And it's hard to find something else that works to lessen the pain when I'm coming off steroids. Like I said, most of my meds stopped working because of being on high dose steroids and being on them for so long. That's why I went to medical cannabis in the end. I also tend to be a lot more sensitive to light and sound, and also just generally far more irritable, which is also ironic because apparently being on steroids can make you angry and irritable. And so does coming off them. Sick one, thanks. Whenever I start to drop in my doses, I usually drop a bit of weight as well. So this section for a while is going to be talking about weight, but I'm not going to tell you my weight at any point, but I may talk about amounts of weight and generally weight talk and weight loss talk. So if that's something that you are sensitive to, it's fine. See you later in another video. But like the amount varies generally depending on where I am with each dose and how high the dose is. And honestly, it's also varied each time I've experienced the dose dropping, and it's the same thing. So I've been through this before, and it's been a different experience this time compared to last time. I find that being on any amount of steroids usually clings on to as much weight and water as possible, and usually I see the most difference in my appearance towards the end, like when I'm on like much lower doses. Like last time I felt like I looked a lot more like myself pre-steroids, and this time round I am and have been just generally a higher weight to the last time I was on this sort of steroid dose. Like I've just been generally a much higher weight since like shortly after that last flare up and starting on a reasonably high dose of steroids again. A mixture of because of starting steroids again, but also depression, comfort eating, that sort of thing. And we were still very much in like COVID is a threat times. I mean, it still is. It still is, don't get me fucking wrong, but like more people cared, sort of, kind of. So it was one of those things of like, I am still further at risk because I'm still on 3 immunosuppressants, and I'm just generally seeing a lot more difference right now in sort of my outward weight changes. However, I don't look the same as the last time I went through this due to the steroids also contributing to like the weight changing my body composition quite a bit. Steroids have a particular pattern of where and how the weight collects on your body, so I particularly have noticed that difference in this last course of steroids versus the first time I was on steroids for 2 years. I mean, personally, I've always carried the majority of my weight on my stomach anyway, and also a bit on my upper arms. But steroids like really exacerbated that, and also like literally changed the shape of my body in those areas. I also gained a lot more on my upper arms this time around and on my face. Last summer, I think I was weighed by one of the doctors in an appointment, and I was quite shocked to see the number had dropped quite a bit from the last time I'd been weighed, and that was around when I was dealing with a lot of nausea and acid reflux as well. So I was also worried that it could have possibly been the nausea and acid reflux preventing me from being able to like eat properly, that could have caused the weight loss rather than the steroid dose changing to something lower. And then this year when I started to taper a little bit again, to get a bit below 5 milligrams, I lost another like two-ish kilograms. And again, I don't weigh myself at home, I don't regularly weigh myself at all, but it's important for my medical professionals to sort of keep track of my weight, particularly from like a Crohn's point of view. So I do let them weigh me every few months or so, like at a consultant's appointment usually. Otherwise, I notice the weight differences based on how my clothes fit and how I look in the mirror in my clothes, or how I look in videos when I'm editing them. I do find that these times when I am tapering steroids are pretty rough because the pain can vary quite a lot day to day, and is quite debilitating at times, and I usually get more headaches because I'm just more sensitive to light and sound from tapering down. I think that could be more of the trigger to some of the headaches I have. Also the stress and pain. I usually get quite a lot around my neck and shoulders, which then also triggers headaches and migraines. So yeah, it's sort of just like dominoes that you line everything up, but if one of them falls over, everything after it falls over too. That's just kind of how everything feels in my body generally, but like especially when I'm tapering off steroids, that one thing starts to be a problem, it then causes something else to be a problem, which causes something else to be a problem, etc. So I can spend hours or days in the dark laying in bed using heat and cold therapy to try and manage pain. The chest pain as well makes it hard to sit up and do things. My stomach can often get quite queasy, I can feel nauseous. I either as well often feel like I need to go to the toilet a lot more, or I struggle to stomach food or struggle to even want food. And then as well it's also harder to sleep because of the pain I'm in. So I tend to struggle getting restful sleep and I'm really fatigued, and that also then causes pain to be even worse because you do a lot of like your healing in your sleep. So that's again another domino moment for coming off steroids kinds of issues. And yeah, after the last time I ended up in hospital, I was very firm with my consultant with tapering extremely slowly this time around and doing it my way. I find the lower the dose, the harder it is to tolerate big dose changes day to day. They often tell you to taper by like a whole milligram. And again, when you're in a higher dose, it's not so bad, but when you're around, like it can still be shitty, like under 10 milligrams, but it's especially bad under 5. I found that just tapering the way that they told me to was just too big of a jump in dose size. It was just kind of like a roller coaster, the symptoms I was having. I would find myself like quite extremely unwell on the lower dose days, and so yeah, I basically just had to advocate for myself very firmly, as my rheumatologist didn't really seem to understand what I was saying, that, you know, whilst 1 milligram it like doesn't seem like a big dose, isn't technically a big dose of any kind, my body feels it as a big jump. I actually saw the Takayasu's team again a few weeks ago, from when this video comes out, where we discussed tapering off steroids, and she said all the right things. She said all the things that I say in this video, basically, and what I've said in every video I've made talking about my experience of coming off steroids. That, like, yeah, literally the same shit. The longer you've been on them, the harder it is to get off them. The lower you get, the harder it's gonna feel. But she, like, acknowledged that and actually even gave her own sort of examples that, like, you know, when you're on 4 milligrams, like I was in the at the appointment time, dropping by 1 milligram is a quarter of your dose, and that's like being on 40 milligrams and dropping 10 milligrams, which is a big drop. You don't really just drop something like that. I can't remember exactly what else she said on that specifically, but, like, as she was saying, I was like, can you tell my local rheumatologist that? Because I have tried explaining it to her repeatedly that regardless of whether it's, you know, technically a big or a small dose to drop, it doesn't matter. It matters that I, like, how I feel trying to get off these medications, that I feel the difference. You know, the thing that they should be thinking about is my well-being. And as I go on to talk about, like, your patient's body's response to coming off steroids is kind of like the warning signs to, like, how you should be dealing with it, because they could go into adrenal crisis, which could kill them. Like, you know. But also, they said something quite interesting that I have never found anywhere online, so I don't know whether it's generally well-known knowledge, but apparently the amount of cortisol your body usually makes in a day is about 3 milligrams of medication steroids, with a good aim of at least getting down to 3 milligrams to kind of just replicate what a body does usually is good. Obviously aim to get off them, because there's more so the long-term side effects of things like heart disease and stuff that won't really appear until further down the line. But I wanted to add that in because I just found them really interesting. Never knew about that before. So whilst it's not really the preferred way of tapering, I use a pill cutter and go down by 1/4 milligrams when I'm in such like a low dose of 5 and under. So a week of tapering for me might look more like 4.5 milligrams, 4.25 milligrams, 4.5, 4.5, 4.25, 4.5, 4.5, 4.25. Sometimes I'll do this for a week or two, which then may look more like 4.5, 4.25, 4.5, 4.25, 4.5, 4.25, and again, maybe do a week or so of that. Again, it all is very dependent on the kind of symptoms I'm having, whether I will do this for a week, 2 weeks, or longer, and then I will settle on on the lower dose around then, or sometimes I'll even continue spreading it out further, so it'll be like a 4.5, 4.25, 4.25, 4.25, 4.5 kind of thing. But eventually I will get down to 4.25 and I'll stay on that for a while before tapering again by another 1/4. I also often consider like what I'm doing for certain days. If I'm tapering at the time and I've got some particularly busy days, I'll usually swing it so that the slightly higher dose of steroid will be on the day that I'm really busy. So like if I've got a market on a Saturday, I'll have the slightly higher version of the dose in my tapering week rather than the lower one. Or like I was planning to go on my holiday, I wanted to get to sort of like a stable, easy dose that I could carry on taking easily for a week whilst I was away. So I took that preparation time before my holiday to get to 4 milligrams, and then I have been on that for a couple of weeks, and I'll also be on that on my holiday, and then I can look at tapering again maybe a week or so after. I also have sort of semi-regular blood tests to check all of the levels that, you know, are important. There's a lot of things that I get tested, but I can't remember exactly what everything is. I mean, generally a few of them are something to do with like red and white blood cells, but a lot of the things that I mainly am looking at these days are my CRP, which is my inflammation markers. We used to also check my ESR, but we don't anymore. And also my liver tests, because of the last medication causing my liver tests to be really bad. And really unpredictable. So those are sort of the main two I look at really, and I leave the rest to the rheumatologist. At the moment, my blood tests are about every 3 months. So yeah, it sort of just depends. If I've got so many blood forms that if I really feel like I need to get any of them tested sooner, then I can. But yeah, I sort of settle on the every 3 months-ish. If things are sort of going fine and I don't feel particularly bad, but you never really know. It can still sort of creep up on you and not be causing you more extreme symptoms, and that's why you need to keep having regular blood tests as you are coming off steroids. Interesting enough, I don't actually know if they check my cortisol levels. I don't think they do. Hadn't thought of that before, actually. Someone probably should have been, but anyway, even the specialists for Takayasus in London haven't said anything, so I don't know, mate. I don't know. I don't diet anyway. Like, I don't go on diets. Usually when I use the word diet, I mean just generally, these are the things I eat these days, not I am on a diet. So I don't go on diets anyway. But I do make an effort to try and make sure I am like properly fed or at least eating regular meals, even if they aren't exactly like nutritious, because being in a calorie deficit is a stressor on the body, and tapering off a medication, especially something like steroids, is also like stressful on your body anyway as it is. And like, I don't really overeat or eat past fullness anymore, like not often anyway, and I don't eat a lot or too much or whatever if I'm feeling nauseous either. Like, I'll try to eat a little bit of something because I know the nausea will get worse if I don't eat anyway, but I don't try to force myself to, you know, eat like a whole meal if I'm feeling nauseous for any reason. I just try to remain conscious that I need to feed my body to help it be strong enough to have the energy to deal with the shit that is going on inside. A lot of the time, tapering off steroids or like tapering down doses tends to wipe me of my energy. So I also don't push myself to do exercise, to be honest, if I don't feel up to it. I've been trying to go on dog walks whilst the weather was nice in the summer, and here and there when it's nice in autumn and such. But you know, as we're creeping into winter, I may not go for dog walks as often because I can't deal with like all the clothes you have to put on, and I also struggle to keep myself warm regardless of what I'm wearing. But we'll see. Sometimes it's nice, but it is something I find very difficult when the weather changes. I also just tend to make sure I have like every form of pain relief available to me when I am tapering down. I have a new heat pad that stays downstairs, so if I'm sitting on the sofa, whether it's watching something or whatever, I'll have that heat pad down there. I've also got my old one up here in my room. I often am using cold packs as well, and biofreeze. God, I live for biofreeze. I will also take paracetamol for milder symptoms or like earlier symptoms. I also have mid-strength cocodamol that I'll take for like when I'm desperate, things aren't working. Obviously I've got my medical cannabis, which at the moment is oil, gummies and flour. Obviously I've got like a selection of vitamins and supplements. Some of them are supposed to be helpful for anti-inflammatory, pain relief, you know, like magnesium, cod liver oil, evening primrose, whatever the fuck, you know, those sorts of things. But also I have magnesium flakes and or bath salts generally for baths, and I also use ibuprofen gel, but mainly for like extremities, like hands, feet, maybe elbows and knees, because I can't take ibuprofen and I can't use ibuprofen too close to anywhere my colon is connected to, because it's often like non-steroidal anti-inflammatory drugs. Anecdotally, they still haven't had a lot of research officially into this, but anecdotally often causes flare-ups and causes inflammation in IBD patients. I think particularly Crohn's, but I can't remember, it might also be colitis too. So yeah, I try to avoid using those in that way. But also I have this old like solid hockey ball that I use for like pressure therapy, trigger points, stuff like that too. And of course I see a massage therapist and a chiropractor, things like that. Being on steroids long term can cause long-term issues. Like I said before, you can develop a whole range of things, but like two of the main ones are Addison's and Cushing. Cortisol is a hormone that is made in the adrenal glands. It helps the body respond to stress and plays many other important roles, including controlling blood pressure, reducing inflammation, helping the heart and blood vessels work correctly, controlling blood sugar, and helping the body use food for energy. And like generally in the Addison's versus Cushing, like it seems to be like they, like I said, they're two sides to the same coin with these symptoms. They have a lot of overlapping symptoms, but there's a few that are like literally the opposites. So with Addison's, you'll have a low blood pressure. With Cushing, it's a high blood pressure. Cushing can also lead to high blood sugar, which can then lead to diabetes. And then Addison's is the opposite, can lead to low blood sugar. And then Addison's needs more cortisol, whilst Cushing needs medications to reduce the amount of cortisol in your body. Cortisol has like more things to do, has an important role, rather than just the whole like it's the stress hormone that we hear all about in, you know, like it's like the buzzword for bullshit wellness culture stuff, really. You know, cortisol has been demonized quite a lot in that media in particular, to be like cortisol is bad, all these bad things happen to you if you have cortisol running in your body, and it's like, well actually if you don't have any cortisol it's also not good for you. So and like I said, it controls all sorts of different things in your body, but artificial cortisol from steroids can also do a lot of things to fuck shit up. However, when you have a condition that's hard to get under control, hard to manage, may not have other treatment options, particularly not well-known ones, you often don't really have much choice. It's that or die, babe. A lot of the time it's literally that. When I covered that House MD episode where the patient had Takayasus, they basically said that the treatment was steroids and that was it, which is absolutely not the case. However, it is not uncommon for people with Takayasus to end up stuck on steroids long term. So I know that I'm not the only one dealing with this issue, but also there's many other conditions this can happen to as well. Literally any autoimmune condition that steroids work for can mean that you end up stuck on it for many years, because it works better a lot of the time than most of the other alternatives. And again, it's like I say in most of my videos, everyone's experiences, everyone's bodies are different and respond differently to their health conditions and different medications, etc. So like that's kind of the gist of the video. I just wanted to kind of go through a bit more in detail of like how tapering steroids can really suck. I try to take things a bit more easy, a bit more slowly when I'm tapering, especially at this like such a low dose, but it's not always possible, of course, and things are stressful, like life is stressful. I just wanted to cover again, of course, my own personal experience, but also like different factors that are important to keep in mind, different things that can stress your body out more that you can avoid doing. And of course, like if you can, definitely eat more nutritious foods. If you've been here before, I struggle with that a lot for a few different reasons. Part of it is having Crohn's. There's a lot of nutritious foods I can't really eat because it does not work. Like, my Crohn's does not like it. Like, I can't eat whole foods because it's too hard to digest, basically, because of my autism and ARFID. I find a lot of textures hard to deal with, variations in texture hard, as well as different smells, and also how food looks as well sometimes. So it's really difficult for me to be able to eat more nutritious food. I try to as and when I can, but being fed is better than not being fed, basically. So if you are struggling to be top wellness nutrition influencer vibes, you know, you're not the only one struggling. Also, it's very unattainable to eat the way that they eat. They don't even eat like that, honestly, most of the time. I have struggled with food and my weight, and especially through this process, this last lot of steroids has really been hard for me and hard on my relationship with my body. But I try to remember, you know, every single day my body is doing its best to just try and live, trying to exist, trying to protect me. It might not be doing it right. It's doing its best though. It's not its fault that that's happening. It's not my fault that's happening. And trying not to punish myself and my body for things that I can't help or control, really. Like, yeah, like I said, exercise is good, but so is rest. Eating nutritious food is good, but so is just eating food, like making sure you are fed. I don't think there's a lot of useful information out there about being on steroids long term, especially not like official studies or articles on it. The most that I find anywhere generally is just basically it's harder to get off steroids the longer you're on them, and it's harder to get off them the lower the dose you get. And that's basically as much as most people know anything about, and it's very annoying. It would be good if there was more evidence-based information to help people like me deal with the ramifications of trying to get off of a medication safely. But yeah, if I do find anything, I will add it in the description. But I have looked into this on and off over the last nearly 5 years, and there's just not really a lot there. There's not really a lot that I can find. So I hope this video is helpful to somebody, whether you're in my position or know someone who is in my position. It sucks. It sucks. It's not fun. And it takes up a lot of brain space. And it just really is disruptive to your day-to-day life because, like I said, you're basically going through withdrawal, whether you are literally or just dealing with a lot of shitty side effects. That's it really. I don't have much else to say. Don't forget to like, comment, subscribe, share my videos, watch my other videos, and yeah, that's kind of it for this week. I will see you next week. Bye.